Good evening, everyone, and welcome. So I am not Delvecchio Finley. Our CEO, the CEO of Atrium Health Navicent, was going to do the introduction tonight. Unfortunately, he's feeling a little under the weather. And if we've learned nothing else from the pandemic, it's that if you don't feel good, stay home. So he definitely regrets that he could not join you here tonight, but he very much is passionate about this subject and was really looking forward to tonight. He kept telling me, there's 75 people registered, there's 85 people registered. So he was keeping up with how many people were registered for this event. That's how excited he was, and I didn't even know that. So, but in any case, welcome and thank you very much to our host, Middle Georgia State University, Dr. Underwood, and to the Navicent Health Foundation for partnering in tonight's important discussion to help raise awareness for maternal health and racial disparities. If you didn't know, we live in the state in the United States that has the second highest maternal mortality rate in the nation. As a whole, the United States has the worst maternal mortality out of all developed countries. That is not something that we're proud of. And so as a country, we're bad. As a state within the country, Georgia's really bad. And Black women in Georgia are 3 times more likely to die from pregnancy-related complications, according to data from the CDC. So of course, in addition to a topic of local importance, next week is Black Maternal Health Week, April 11th through the 17th. The whole month of April is Minority Health Month. And so at a time when individuals across the country are invited to help raise awareness, we felt what better time is it for us to come get out of the hospital and into the community and talk to community members and students and future healthcare workers and employees than this month, than right now. It's been shown that the toxic stress mothers face before and during pregnancy, the microaggressions, the racial inequities negatively impact the health of Black mothers and their babies. We'll go on a journey with a Black mother tonight and learn more about a day in her life. Before we do that, I'm going to do some quick education to get you in a certain frame of mind while you watch the film. As I said before, maternal health is not just a national issue or a state issue. It's of great local importance as we look to improve the Central and South Georgia of today and the future. Mothers give birth to the next generation, but they also nurture our community's youth. I'm proud that tonight's discussion is one in a series that we've hosted since last spring, and we are committed to keeping this conversation going in hopes of making a real impact to improve maternal health. Atrium Health Navicent's mission is to improve health and wellness, elevate hope, and advance healing for all. Atrium Health Navicent has partnered with the American Hospital Association to work on maternal mortality education through local maternal health forums like this one, as well as national panels. I'm going to be moderating tonight's event, and we invite you to listen. We want you to ask questions. We want you to be part of the solution to this critical health issue. Now, I'd like to turn the microphone over to Dr. Tara Underwood, Dean of the School of Health and Natural Sciences here at Middle Georgia State University. Dr. Underwood.
Good evening. My comments will be very brief, but I want to once again thank you all for joining us this evening for a very important topic on maternal mortality. And wow, I was not aware that it was that bad in the nation and the world. Those are some phenomenal statistics. As a public health worker myself, I've done this for over 30 years. My specific research interests were in rural care, rural health care. And later on, you'll hear from Dr. Jimmy Smith. Dr. Smith and I have done studies specifically relevant to rural health care challenges. But tonight, I'm here to welcome you once again to Middle Georgia State University. Again, we are doing this live stream from what I understand. A little bit about me and why this topic is very important to me is I'm a mother of 4 children, well, young men now. They're 28, 25, 23, and my midlife surprise is 9 years old. All boys, but I also experienced the stress that may have contributed to a miscarriage as well before I had my last son. And so please pay attention, take notes. I'm sure you're going to contribute to a very engaging conversation about a very important topic, and I'm a lifelong learner, and I encourage you all to do the same. Be lifelong learners as you continue to pursue healthcare professions and as you go on in life as future mothers and wives and aunts and husbands and fathers. Just take on the information that you're about to hear tonight. Thank you. And by the way, I'm double booked. We have an honors convocation going on in another building, but I am going to be standing in the back taking in as much information as I can before I have to depart.
All right. So, like I said before, the event tonight is going to have a couple of parts to it, 3 parts rather. First, we're going to briefly talk about unconscious bias and what it is, why it applies to the discussion tonight. And after that, we're going to watch a film. It is an incredible film. It's short, 20 minutes. I see some snacks out there, some popcorn maybe. It's entertaining, but it's also very thought-provoking. And after we watch that film, we will have a panel discussion to debrief and download. It's a little heavy, so you will need time to be able to debrief and download after the film, but it's entertaining, it's current, it's well made, and you're going to really enjoy it and get a lot out of it. So without further ado, we're going to jump right in. That's me. So one thing about me is that this particular topic you'll find that I'm extremely passionate about. In my current role, I'm the Chief Medical Officer for Atrium Health Navicent Health System. But before I had my administrator's hat, I was and still am a board-certified OBGYN. And while I don't currently clinically practice anymore, I still, am heavily engaged and involved through events like this and other events. I continue to work with my clinical colleagues, students and residents, and so I get a lot of satisfaction out of doing that. So not only am I here to moderate because I'm a hospital administrator, but I'm also a physician, and so this topic hits very close to home for me. All right, I have nothing to disclose, but if anybody would like to give me something, I'm definitely open to having disclosures. I don't have anything right now. Okay, so what do we mean when we say unconscious bias? Unconscious bias is preconceived notions and prejudices about people, places, or things that result in unearned positive or negative effects. We usually think of a bias or a prejudice as something negative, but we're going to talk about some potential, positive aspects too that, while are somewhat good, are somewhat bad as well. So after leaving here, I'd love for you to be able to describe the effects of unconscious bias in interactions with your fellow students, your patients, colleagues, team members. Be able to identify where your personal unconscious biases reside across gender, race, ethnicity, and/or cultural attributes in the workplace. I'm going to give you some specific bias-busting techniques that you'll be able to walk out of here and use moving forward after today. And then develop strategies to correct personal unconscious biases in your daily interactions. So why do we have these unconscious biases? If these are our prejudices, why do we really have them? Well, it's really a coping mechanism in a way. It's a way that our brain allows us to interact with all the inputs that we get on a day-to-day basis. We encounter so many different things and people, sounds and noises that our brain has to be able to file those things away in a manner that doesn't drive us crazy. So I always like to give an example of something that's really, really basic. But when you think about if you were a primitive man, you were out in the jungle somewhere, and you had never encountered a ferocious tiger before. You came up on the tiger and you didn't know anything about that tiger, and you looked at him and he looked at you and you thought, oh, he's kind of cute, he's kind of fluffy, I don't know. And then that tiger attacked you, and you lived through it, I guess. Then the next time you encountered a tiger, what would you do? You would run, right? Because you would have learned from that initial interaction that you had. Well, our biases really are that. They are us trying to categorize the inputs that we get. And that's not necessarily a bad thing. We have a split second to make a decision about is fight or flight. Should I stay here or should I run? And many times that can be protective. But as civilization has advanced and become more nuanced and educated, we understand that it's not always fight or flight, that there are some things that we need to understand about how our brain tries to put certain people and places and things into these categories. So what influences that mental database? Everything: our ethnicity, our own religious ideals, our family, our culture, the environment that we grow up in. You know what? This is actually the long version. This is the wrong version. While I'd love to give you guys the long version, this is going to take, I opened up the wrong one. So if you will bear with me for 30 seconds. Unfortunately, it's the wrong one. I've given this several times, and I have a long version and a short version. This is the same one. All right, this is the short version. Invite me back and I'll give you the long version, okay? So after that intro, so ultimately, why should you care? You should care for a number of reasons. And especially, this is especially applicable in healthcare because biases lead to uniformity. Multiple studies show that groups or teams that are more diverse outperform otherwise matched cohorts. Everything you do from here on out, you're not going to be doing alone or by yourself. You're going to be part of a team. You're going to be part of a healthcare team that has all kinds of other clinical and even administrative people on that team. And the good thing about that team is each person brings something to the table. Each person brings their own background and expertise, and that's actually a good thing. You don't want everyone to be the same or be thinking the same because each patient that you treat is not going to be the same. But what else? Unconscious biases could affect your bottom line. In 2015, women earned 83% of what men earn. Okay, that was 2015. It's 2023. Why is she putting this old statistic up? Guess what? It's still the same. I said that I was not going to change this slide until I could say something different than what's on here, and it's the same, okay? The Census Bureau found that women earned 83% of what their male counterparts earned in 2015. This is looking at full-time, year-round workers, so there are some caveats. But so having a bias can affect how much your take-home pay is. Providing feedback. You all are your students right now, your teachers give you feedback, and one day you may be in a position to give feedback, not just to a student, but to a colleague. You may be asked to give your opinion about a device or any number of things, and we want your feedback to be without bias because that could impact the decision to purchase something, the decision to hire or fire someone. Customer care. Full body scanners have trouble identifying people with thick hair and certain head coverings, causing more TSA pat-downs. So just something as simple as your hair or head coverings could put you in a situation where you're more likely to get a certain type of treatment. We are going to do an activity. This still is not the right one. My goodness. We're going to do an activity. I have multiple activities, but we're going to do, that's not the right one. Oh, dear. I don't have my life together today, you guys. This is the right one. I promise you it is. Okay. We're going to do an activity because the first key to combating bias is to recognize it. So what you're going to do very briefly is you're going to rate the following individuals. I'm going to put some pictures up here. You're going to rate them on a scale of 0 to 10 on just 2 elements, okay? I want you to think about whether or not you feel they are compassionate or how compassionate you feel on a scale of 0 to 10 and how competent you think they are. Competent, general competency as a human being, okay? Not anything in particular. And you're just going to have a matter of seconds to make a determination based off of the picture that I put up on their level of compassion or competency. Some of you may have done this before. If you have, don't spoil it for others, okay? All right, first picture. Remember, you're thinking about compassion and competency on a scale of 0, 0 being none, to 10 being the most. How compassionate, how competent? Scale of 0 to 10. And this is the last one. You guys might get this one as a freebie because I had the answer up there before. All right, very quickly, let's go through. What did you think of this person? Do you think did he appear compassionate? What do we think? Maybe? No? What about competent? What's up with the number on his arm? Might be his inmate number. That's what I thought. That is exactly what I thought. The first time I saw this, I was like, oh, that is an ex-con. That's his number. Does anybody actually know who this is? You may not have known who this is, but after recent political circumstances, you might have a better idea of who this is. He was. Very good. So this is John Fetterman. He is currently a U.S. Senator from the state of Pennsylvania. Before that, he was lieutenant governor. And before that, he was mayor of Braddock, Pennsylvania. He has a BA in finance from Albright College and a master's in public policy from Harvard. So that number on his arm is the zip code of Braddock, Pennsylvania. And he was recently in the news. Of course, he just got elected, but he had a stroke. He had a stroke recently, and he did this debate, and everybody was kind of talking about him. His speech was sort of slurred. I don't know if you guys watched TV, but it was a big deal recently. So before that, most people probably definitely wouldn't have known him, but that was happened pretty recently. What about this one? Compassion. She looks pretty compassionate, doesn't she? She looks like somebody's grandmother. She looks like she would take care of you. What about competency? Does she look like she's somebody that can take care of things and a go-getter? Maybe, maybe not. I will tell you, the first time I saw this, I thought, I'd love to eat her food. We all have biases. That was a bias of mine, okay? Does anybody know who this is? This is Pratibha Patil. She was the first female president of India from 2007 to 2012. Very competent. Competent enough to run a whole country. Might be able to cook too. I don't know. I can't can't say anything about her ability to cook, but definitely can run an entire country. All right, what about this? Does anybody know who this is? Shout it out. Who is this? He's a serial killer. He's a serial killer. I'm telling you, when I saw this picture, I thought, well, he looks like a jolly fellow. He's got those crinkles around his eyes. I thought that that was a good sign, that he was happy and friendly. I mean, I guess serial killers have to be friendly to like lure you in, you know, before they kill you, but this is Ted Bundy. Ted Bundy was a prolific serial killer, and unfortunately, the only pictures I could find of him were black and white because this happened so long ago. But he killed at least 30 people, at least, probably more. There's others that out there that they don't know about, but serial killer, and yet, you know, dress him up in a suit. It's got the eye crinkles. Looks nice. What about this one? Who's this? Do you think she looks compassionate? Yeah. What about competent? Yeah, she looks compassionate and competent, and she is both. So this is Dr. Mae Jemison. She's an American engineer, physician, and NASA astronaut. She was the first black woman in space. Amazing. So the picture that you see down there, I don't know if I can do the laser pointer. This was the picture from when she was younger, when she was actually an astronaut. This is a more current picture, but this is the one that most people are used to seeing of her. So, all right, last one. You're probably not going to know who this gentleman is, but what do you think about does he look compassionate? Yeah, no. Competent? Definitely looks male, right? He does. Well, this is Jamison Green. He's a transgender male. He's a lawyer, educator, and policy advisor on transgender issues. And I put this one up here, not necessarily that you would know who Jamison Green is, although he's fantastic, but that just like all the other ones, you can't judge a book by its cover, but in healthcare, you definitely can't judge a book by its cover. If Mr. Green still has a uterus and a cervix, he still needs to be seeing a gynecologist. Now, what would you do if you walked in a gynecologist and saw Mr. Green sitting, you know, in the lobby? You might think he was there with a spouse or a wife or a girlfriend or something, and might not think he would be there for himself. Or if you saw him as his primary care, you know, doctor or provider, you might be thinking about all the things that, you know, I need to check his cholesterol, I need to make sure his heart's working. What about a mammogram? So we cannot let what someone physically looks like, especially in healthcare, we cannot let that completely drive and impact what we do and what kind of services we offer an individual. We really have to understand and know who they are and what their personal risk factors and personal healthcare needs are. All right, I have other activities that are in the other slide sets that I'll come back and do at another time. But what we're going to do now is very quickly talk about the different types of bias. And you don't necessarily have to memorize all the different types of bias. I really just want you to understand that there are multiple kinds, and it's not just prejudice, even though that's the one we think about the most. But there's all different kinds. There's stereotyping. That's one that we're pretty familiar with, where we use these broad generalizations to make inferences and judgments, where we lump people in the same category together. There's affinity bias, when we prefer people who are similar to ourselves. Who in here is left-handed? That's what I'm talking about. She's my favorite person in here, right? So we do that a lot. We find something in common with people, and we think that automatically makes them cool or special or good because they have this, you know, same likeness as we do. So that's one of the ways that it's actually, we can get unearned positive things from prejudice. It's not always negative. That just knowing that little thing about someone may cause me to treat them a little bit better than I treat all these right-handed people over here. Okay. blind spot bias. That's when we recognize other people's biases, but not our own, right? Because we're never the problem. It's not us. It has to be everyone else out there. But we all have our own biases, so we can't have blind spots to our issues and always point the finger at others. Confirmation bias is the tendency to accept evidence that confirms our beliefs and to reject evidence that contradicts them. And we do that more than we would think. And social media and the internet helps us do that too, right? Because it tracks your search patterns and it pushes information to you that's consistent with the other things that you've already searched. So if you search something that's a little borderline, you're looking, you don't know the answer to a question, so you're Googling something. It learns from that unless you turn that off on your computer, and it continues to send you certain things, or it searches for those things. It pushes those things up to the top of the search list. So you have to be careful about what you're getting, what you're reading, and make sure that it really is evidence-based, okay? Because we practice evidence-based medicine, and sometimes that evidence might not be what you want it to be, or might not be what you want to hear, but that doesn't make it, incorrect. So confirmation bias is really important to know and understand, especially in healthcare. And then last but not least, there's groupthink. That's when we're vulnerable to taking the opinions of the group instead of offering a dissenting opinion. And I know all of us have been in a situation where we're hanging out with some people. Maybe they're our friends, maybe they're not. Maybe they're classmates. And the group is like, man, I really dislike X, Y, and Z. And people are like, yeah, me too. And you're the one that's like, oh, I think they're cool, or that doesn't bother me. Do you speak up? Or do you go along to get along? So groupthink can get you into trouble because you get further and further down that road away from who you really are and what you really feel, and you allow the group to lead you down a path that could be, at best, it's biased, but at worst, it could certainly lead to a lot of other bad things. So what do we do? I'm going to give you a handful of general strategies that will combat, all of the things that we just talked about. Again, not necessarily for you to be able to list all the different kinds of unconscious bias, but just know that it comes in more than one format. So 3 general strategies that we're going to talk about. The first is perspective taking, and that's really exactly what it sounds like. Take the perspective in the first person of a member of a stereotyped group. So the first cartoon here, you've got the people, the two individuals here sort of thinking about the other, but from their own perspective, right? So I want you to do the opposite of this. So the first lady here is saying, everything covered but her eyes. What a cruel, male-dominated culture. But the other lady is saying, nothing covered but her eyes. What a cruel, male-dominated culture. And that's how we tend to see the world, right? We tend to see the world the way it is to us. But what you really should try to do is put yourself in that other person's shoes. So the second cartoon, you've got these 2 eagles. They're hanging out, they're drinking coffee and reading newspaper because that's what eagles do, right? So the first eagle says, do you think the owl is a predator? Of course not. He's never bothered me. Exactly. I had no idea what Mr. Mouse was going on about. So one person's predator is another person's prey. And if you only think about something from your own perspective, of course, an eagle wouldn't think anything about an owl being a predator, but a mouse would. And so, again, you really have to put yourself in the place of the mouse to understand their perspective. What else could you do? Individuation is similar, but not exactly the same. And that's when you obtain specific information about members of a group so that you evaluate them based on their individual personal aspects rather than the group-based attributes. And again, we tend to group people together very often, right? So we lump everybody together. Blonde people, So instead of putting people, in that group, you need to get to know the individual people. And then that, okay, that person has blonde hair, but that doesn't mean anything about their intellectual capability, right? And then last but not least, practice the camera exercise. The camera exercise, again, Easy to say, hard to do, but I want you to try to look at a situation as through the lens of a camera. And that means that you can only see or say exactly what it shows. Everything else is an interpretation and not a fact. So, what's going on in this picture? He's holding a baby and he has his hand up. Thank you. That's exactly what you see. How many people were like, he's giving him a spanking? You don't know that, right? What if that child is choking? What if he's choking and he's, hitting him on his back because he's choking? So when you practice the camera exercise, you only say exactly what you see. Don't put any interpretation of why something's happening or how it's happening. That will give you, a basic sense of, okay, this is what's going on. Now let me have them give me the information. I'll give you examples. As a physician, I have not done this many, many times. I walk into a room, I see two women in the room. One is pregnant, one is not pregnant, one is younger, one is older. And I approach the pregnant younger one and go, oh my gosh, you brought your mom with you. No, that's my partner. Oh, my bad. So it's so easy to do because you walk in and you make this quick assessment of what must be going on, right? That must be what's going on. And it's not, right? So you really have to practice that to make sure. So the lesson learned from that is you walk into a room and you say, oh, Miss Walker, who do you have with you? And you let them tell you who that person is in the room, and then you go from there. So you allow the patient, you allow the person, whoever it is, to tell you what's happening. All right, we're going to wrap up here. So what's next? I will leave you with one of my favorite quotes by Linus Pauling, who was a Nobel Prize winner. And he said that we should do unto others 20% better than you would expect them to do unto you to correct for subjective error. I love that. Let's treat everybody just a little bit better, just in case, because there's probably some bias at work. Probably, right? So what we're going to do next is we are going to watch the movie. Like I said, it's 20 minutes long. It's really engaging. I've really already kind of gone over a lot of these statistics. I talked mostly about the mothers, but in the United States, Black babies also die during the first year of life at twice the rate of white babies. And I mentioned this in my opening remarks too. It boils down in many cases to inequities. Inequities are like a substrate that women must navigate as they live, as they work, as they play. And what's a substrate? That's the environment around us. And for some people, for some women, that substrate is like, it's like air. It's like nothing's there. Everything's fine. For some women, it's like a mild shower. I got my umbrella. Got my cute little rain boots on. I'm okay. And then for some women, it's like navigating through landmines in a hurricane. Okay, we just had a tornado, come through a week or two ago. And for some women, every day of their lives is like a tornado. And all of those things create some stressors that ultimately cause your body to not be as healthy as it otherwise could be. So I want you to have these things in mind as we get ready to watch the movie. And after the movie, we'll give you a minute or two to decompress while our panelists come up on stage. So with that, let's take it away.
Baby, can you go wake Michael up for me, please? I gotta get ready. Please, come on. Love you, thank you.
So you want to get purple shoes lighter than your own. Take your dab lunch. And you want to just like
Morning to you. The news this morning, a planning application which will affect the future of Sellafield nuclear plant the NFL want more storage facilities for intermediate radioactive waste. The company says if they do not get the go-ahead, they will have to stop reprocessing by 1990.
You doing your homework?
New 1.7 billion
Doing your work?
I'm almost done.
So am I.
Okay. Don't let your mom see you. She's gonna say something to you.
Good morning. Michael.
Good morning.
How are you?
Hey. Get you some breakfast.
Wait, that better not be your homework.
I'm almost done.
What do you mean? What were you doing last night?
I was working on it.
My God, Don.
Now, on to our top story. A 12-year-old boy was shot and killed by a city police officer Saturday morning. According to the officer's statement, the boy was wielding a BB gun that the officer perceived to be a firearm. When asked to
Oh my
comply,
gosh, come on, you guys, not today.
Damn. Okay.
Don't.
Yes, I will.
I don't know about this hair. Like, what do you think?
You gotta let that skin glow and that hair grow.
Oh my gosh.
Wait a minute. Is that the skirt that you had on that one? That you had on
I
the
know
night
you're not
that...
gonna talk like that in
Oh.
front of your son.
Anyway, did you take your vitamin?
No, not yet.
How'd you sleep last night?
Okay, I guess.
Guess.
Yeah, I mean, I had a little pain, but nothing too bad. It's
Should we
okay.
call Dr. Gupta?
Why? So she can just dismiss whatever I have to tell her like she did last week?
You went to see her last week? Why
Yeah.
didn't you didn't tell me that.
It was nothing. I just had a little pain, that's all.
You still gotta tell me that kind of stuff, though.
It was nothing.
How have you been doing?
To be honest, not too good. I mean, I've been having a lot of pain and cramping in my lower abdomen.
Yeah?
Enough that I thought I should come in and see you.
Sounds like round ligament stretching. Pretty common.
I just don't remember having this kind of pain with my first baby.
Nina, I know this is not your first pregnancy, but I'm sorry to tell you, not all pregnancies are the same. It's not always comfortable, and plenty of women overreact to these things.
Overreact. I don't think I'm overreacting.
Everything is fine. Just go home and treat yourself to a relaxing evening. I'm sure you'll be feeling better soon.
Wait, but is there anything that you... Oh my God.
Go to the doctor.
Thank you. No, I mean, besides, I don't know. I mean, I have the depositions today and that big trial. I don't have time for a doctor today.
So then we need to talk later.
Okay.
Oh, by the way, I got a late meeting today, so can you pick up Michael from school? I can just grab some dinner on the way home.
Okay. It's not like I just literally didn't tell you how swamped I am today.
I got it. Don't.
No,
I'll
it's
do it.
fine. I can do it. Just tell me what time you'll be home. I know you know better than that.
Sorry.
Just for that, you can say grace. Come on. Let me tell you twice.
Thank you, God, for this food, for rest and home, for everything that is good, in the wind and sun above, but most of all, those we love. Amen.
Amen.
Let's eat. I am starving.
When we get home later, I want you to put your wrestling clothes in the washer. What time are you getting out of practice? Michael? Are you listening? Michael, I'm talking to you.
I heard you.
Well, what time do you get out of practice?
4, but we're going to the skate park after.
And who's we?
Me, Jamie, and some other kids.
Are any parents gonna be there?
Parents? Why do we need parents? We're just going to the skate park.
Another day of protests downtown today after the shooting of a 12-year-old African-American boy who police say was wielding a BB gun.
Sorry, not today.
Why?
Just not today, okay?
God, it's so unfair.
You're right, it is unfair, but I'd rather you not have to find out the hard way when you and your friends are picked up and you're the only one going to jail.
I'm just scared because of the news. We're not going to get shot or anything.
Enough, Michael. I love you. Oh, our mango.
Good to see you here today.
Hi, how are you?
Got a minute to talk?
Actually, I'm in a bit of a rush. Is everything okay?
Yeah, well, it was just a problem with Michael's wrestling team.
Oh?
Yeah, it seems he's going to have to do something about his hair if he wants to stay in the program.
His hair?
Yes, well, I guess there's a league rule that says boys can't have dreadlocks. It interferes with the matches.
He's wrestled in dozens of matches. It's never been a problem before.
Well, I believe it to be a new rule. Well, some of the other parents have been complaining about the lack of enforcement of the rule.
So does this mean all your boys with locks are having to cut them?
No, just Michael.
Oh, just, okay. Well, I'm gonna get going, but I will definitely talk to him and his father tonight and get back with you as to what we decide to do with our son's hair. Okay?
Of course, and I hope this doesn't seem like it's anything other than policy.
No, why would it?
Right.
Have a good day.
You as well.
Has his locks forever. Talk to me about his hair being a problem on the team. It's just unbelievable. Wait till I tell Don. So does this mean all your boys with locks are having to cut them?
No, just Michael, just Michael. Hey, some of the other parents have been complaining, lack of enforcement of the rule.
I hope this doesn't seem like anything other than policy. The policy.
Morning. Good morning, Nina.
Oh, hi, good morning. How's it going?
Well, I know Carl called us here for this meeting, but I think I'm missing a couple of things on this Dan's case.
I'll give you everything I have.
All right. Let's see what we got here. So, have you seen the new intern? I was 20 years younger.
And what would your husband say about that?
Oh, I don't think he'd mind if I was 20 years younger.
Ooh.
Oh, are you okay?
Yeah, I think my little mango didn't like what I ate for lunch.
I love mango. Did you have it in your salad?
No, not. Never mind.
At least you're over the morning sickness part.
True.
I remember with my first two, I was sick all the time. The third one, I didn't feel a thing. Though she's the one who gives me the most trouble of the three, there's some irony in there.
Did we get any word back on the Blair case?
Nope, still waiting to hear back from the judge. Oh, did you hear about the Williams case?
Hear what?
Well, Leo managed to get a sentence reduced down to community service plus probation.
Are you kidding me? 18-year-old frat boy rapes a passed-out girl and gets probation? Because he is a promising college kid who made a mistake and his life shouldn't be ruined. Meanwhile, my pro bono client, who's only 16 by the way, finds himself at the wrong place at the wrong time with the wrong crowd with no idea that he's sitting in a getaway car. Now he's being tried as an adult for armed robbery and had nothing to do with it.
Well, yeah, but he's from Kinsman. Nothing good ever comes from Kinsman.
I'm from Kinsman.
You know what I mean.
Yeah, I know what you mean.
Anyway, there's probably more to it than that. He might have gotten in a fight with the police or had drugs on him or something. Oh, I forgot to tell you. I went to that soul cycle class yesterday, and guess who the teacher was? It was that woman with the crazy green and pink hair. And she was telling this story about her cat. How her cat has learned how to ring the doorbell in order to be let in. It's such the craziest thing, isn't it? I mean, that's funny, right? Nina? Funny, right? Nina?
Hey, how was school? Who was that?
Who?
With the long hair?
Riley?
Does he wrestle?
Yeah.
Here?
Yeah.
Got the nerve to talk to me about some hair today.
I'm hungry.
I can't control the traffic, Michael.
Can we stop and get something?
Your father's picking up dinner. Can't you wait?
Is that for you?
Oh my gosh. I don't know.
Was you speeding?
No. I'm doing like 30. Like, this is crazy. There's no shoulder. I guess I'll get off right here. Great.
I thought we was gonna get a DWB.
What is that?
Driving while black?
Right. It's crazy.
Want me to look for directions back on the highway?
No, I know these streets.
I mean, we were just sitting back, you know, chopping it up, reminiscing about the good old days and all that. You know, tracking my roots, where I came from and where I'm going. But like I say, man, always said it.
This place is shady as
Boy, you better not finish that sentence.
Sorry. Oh, can we stop and get something? Here? Please, I'll be quick, I swear. Please. Before we pass it, please.
All right, but be quick.
Quick.
I mean, real quick.
You put a baby on top of that baby. Hey, let us do this shot. What you mean?
Do you guys have any fruits or granola bars?
No fruits.
Okay, I understand about the fruits, but do you have any granola bars or power bars or something like that?
No granola.
Still keeping this place stocked with healthy options for the community, I see.
Sir, do you have any quinoa by chance?
Don't. No, he doesn't.
Swipe your snap card.
What? What's that?
Do you have a snap card?
No, I don't.
You ask everyone.
So that's not his name?
No, it is, but not when he raps.
Well, what is it when he raps?
Childish Gambino?
Let me get my candy. Childish Gambino. Childish? How old is he? And what is a Gambino? I mean, what does it mean?
I don't think it means anything. He came up with it on some Wu-Tang name generator. Wu-Tang, it's a group from the 90s.
I know you're not trying to teach me about Wu-Tang.
Yeah.
As we dwell in this concrete hell, call it at home. Mama say, take your time, young man, and build your own. No mind up like your old dad. Still searching for the glory days he never had. What? You trying to teach me about Wu-Tang?
I thought you only listened to jazz.
Listen, honey, I've been shadowboxing since before you were born. Okay?
That's pretty cool. I ain't think you had it like that. Mom,
Oh,
you okay?
oh. Call your dad. Call your dad. Oh, call your dad.
Hello? Dad, Mom's in pain.
Here we go. I need you to give me a good deep breath and let's go. Yes, come on, Nina. That's good. That's good, Nina. That's good. Okay, I can see the baby. The baby's coming up. Very good, Nina. That's great job. Great job. Great job, Nina. Nina, I'm going to give your baby to the NICU doctor so that he can take care of him and I can take care of you, okay?
Is the baby okay? Is the baby okay?
Nina, he's going to be okay.
Baby okay?
Baby's weight, 400 grams.
How's our chest rise?
I've only got it on one side.
Let's adjust the breathing tube.
The heart rate is dropping.
Let's start chest compressions. Let's start chest compressions.
out right now?
Looks to be a few slowdowns.
Just turn it off.
Make sure you stay tuned for the latest.
Yeah. Moment of silence. Too fast they lived and too young they died. To my people I salute in the sky. And I can't fade your memory, pain still continually. I admit sometimes I cry. Now this is dedicated in the memory of, to my people up in the sky. Loved ones watching from above had an impact, purpose for they vanished from the surface. Honor your presence with legends made, some shattered, worthless. To the siblings that's living with no mom and no pop, deliver words in the prayer so the pain can stop. And the ones still mourn when they heart is torn, reminiscing either when smoking or the
So as our panelists come up, let's just take a few minutes to decompress. Like I said, it was a good film, but it was heavy. It was heavy. So we're just going to take a few minutes to collect our thoughts. I'd love for you to think, how do you feel right now seeing that? Does it remind you of anything? Can you relate to that? And you don't have to look like that family. You don't have to sound like that family. Okay. I'd like to briefly introduce the panelists. I know that you have their bios in your program, but first I'd like to introduce Dr. Jimmy Smith, who is the administrator for the Macon-Bibb County Health Department, and I also see his beautiful wife is also here. Dr. Monique Davis Smith is back there. She's also a physician, a family medicine physician. Thank you so much for being here tonight. We also have Dr. Melva Jones, who is a registered nurse from Monroe County. Shout out to Monroe County. All right, I'm from Monroe County too. And Melva and I cut our teeth in labor and delivery together. So when I was a resident, she was a labor and delivery nurse. Fantastic. And then we have Dr. Felicia Love Kitchen, who is an OBGYN at Atrium Health Navicent. She's also the program director of our OB residency program. And then we also have Dr. Catherine Sylvester, who's a physical therapist, a pre-eclampsia survivor, and a VBAC certified doula. If you're not familiar with that VBAC term, that's vaginal birth after cesarean certified doula. So we have an illustrious panel tonight, and we're going to have a conversation, okay? And we want this to be interactive. I'm going to ask some questions of the panelists, but we're also going to have time for your questions and for your comments. There will be microphones. There'll be 2 microphones floating around. So when you have questions or comments, raise your hands, because we want to hear from you. We want to hear your thoughts, and I want you to leave tonight hopefully different than you came in, and hopefully you'll take something away that you can use in your own homes, in your own friendships, and definitely in your careers in healthcare and wherever else life may take you. So I'd like to start with, I really want to start with a general question. Several of the panelists have been with me in previous sessions like this, and then there's a couple of panelists that this is their first time. So I would love to hear, so 2 of them, Dr. Smith and Dr. Kitchen, have been in previous sessions, and then Dr. Jones and Dr. Sylvester, this is the first time on a panel in this setting. And so I want to hear from each of you, those of you that it's not your first time and those of you that it's your first time. What are your initial thoughts after this video? I've seen this video multiple times, and every single time I see it, I get a little something different, a little something else. So, Dr. Smith, I'd love to hear your thoughts.
Okay. Can you hear me? Okay. Good evening, everyone. Glad to be here with you. I, like Dr. Walker, every time I see it, I get something a little different. And the biggest thing that I get out of it tonight, particularly after hearing, though we asked for a moment of silence, we probably wouldn't have had to, because you went very silent. So part of what I get out of this is we can do more, and I specifically say we can do more and not what should we do. I think we've studied it enough, and I think if you started at the very beginning of that film and started watching, there are pieces where we can intersect. There are pieces where we can make a difference. Everything from the news story to what was on the table at breakfast, to the conversation at the school, to the interaction with the physician, to the interactions they had in the store. In every piece of that, there could have been changes. And those changes probably could have had a positive impact on the outcome. So with that, I would tell you, and I'm assuming most of you in here are going into the nursing profession, step outside of your profession and help in those other places. You can interact outside of the office. You can interact outside of the hospital. You can interact outside of healthcare. And our community needs that interaction to move forward.
Thank you. Dr. Jones.
So, hello. Can y'all hear me? I would like to piggyback off of Mr. Smith. Of course, there were pieces that we could fix medically when she was with the doctor, and the doctor kind of brushed her off, right? But also, like what we teach you guys when we're doing our histories and physicals on our patients, we do need to know about their background. You know, do you have any drug, alcohol abuse? Do you have support at home? Where do you work? Those type of things. And it seems kind of silly sometimes when we're teaching and you're like, oh, they're here for a headache. Why do I need to care about all these other factors? But as you saw in the video, patients are coming with other stressors than just what they are presenting at the hospital or the clinic with. So it does kind of take a full picture to understand what that patient is going through.
Excellent point. Dr. Kitchen.
Hi, I'm sorry, full disclosure, I am a little under the weather, so a little scratchy throat, but bear with me. Every time I see this film, it is quite jarring to recognize that as a healthcare professional, her physician did not take her seriously. And you all are all learners and budding healthcare professionals. Take a moment, listen to your patient, take them seriously, examine, actually touch your patient, examine your patient. If they have a complaint, try to figure out, is this a real complaint, or is there a social situation that could be leading to this feeling that this patient is having? You can intervene in so many different ways. So as a healthcare professional, when I see this film, I just think about all of the places, the stopgaps where this could have been prevented. And as healthcare professionals in the future, you guys are going to be the ones that are going to need to do this. So pay attention.
And Dr. Sylvester.
I think about the lack of a reaction to death when you see it every day. I think about how my son cried and couldn't sit in the room after watching this movie. But as healthcare providers, sometimes death just becomes a part of it. If 23,000 babies are dying every year, then do we become desensitized to that? Because the mom has to go home without a child. And I think that as healthcare providers, it's our job to stop that from happening at all costs. But in this video, you don't see any, you see her crying, but the doctor will go on and deliver another baby. And so I just think that when we get to the point in our career when death stops bothering us, then we should stop.
Thank you. Does anybody out in the audience want to say anything at this point? Your sort of initial reaction? Not yet. Well, Dr. Kitchen, you said something really important, and I'd like to hear more about it. I'd like for you to tell us a little bit more, because we know that self-advocacy is crucial.
Mm-hmm.
But when people fear that something is going wrong during or after childbirth, how can they get their healthcare provider to listen to them? What actions can they take so that if a patient says some certain thing or certain phrase, how can we make sure that we are hearing them?
So are you asking how the patient can make themselves heard?
That, but also the reverse too.
From the reverse,
Sure.
okay. So, if patients should never stop telling us exactly what they're feeling and what they're thinking. I always tell my patients, I always ask at the end, are there any questions? And I usually get blank stares like you all are doing right now. But I ask over and over again, and I tell them, when you go home, you write down everything and come back and tell me when you come in to see me next time, because I need to know these things. And also, if a patient has a support person, make certain that they are your advocate as well. It really irritates me when father of the baby is laying on the sofa asleep as mom is struggling through having this baby, and she is terribly exhausted at the end. She may not be able to make her feelings really known to the healthcare providers, but he could actually intervene. So I always also encourage patients and their support personnel to be very vocal, be very proactive in telling us what they need. On the flip side, as healthcare professionals, as I said before, we need to listen. We need to stop. And healthcare is so busy. We are always moving, constantly doing something. Every time I turn around, there's like 50 different things going off. But if a patient says something's wrong, I have to stop whatever else is going on, and listen to them and really think about, okay, how am I going to address this? How can I help this person? And if there are some times when you, as a healthcare provider, you see patients over and over again, and they always have the same complaint, and sometimes you want to brush them off. Don't. So it's definitely twofold. As a patient and a support person, you have to be proactive, but as a provider, you have to listen.
Thank you for that. I'd like to go back to Dr. Jones, and I'd like for you to share with us what are some of those daily stressors that pregnant working women experience, and how can those experiences be exacerbated for women? I think you started speaking about that in your, in your statement, but I'd like for you to say a little more on that.
Okay, so just looking at daily stressors outside of what her chief complaint was, right? So, of course, she's a mom. She's describing how busy she is at work, all these deadlines and things that she has to meet and what she has going on. And her husband's like, yeah, but can you pick up, our son at the end of the day? And she's like, I just told you I have all this stuff going on, but fine, I'll do it, right? And, a lot of times as women, we're always like, I'll do it. We're taking on the brunt of, like raising the children, working, providing all the meals, taking them to school, picking them up from practice. She's constantly hearing on the news of a young boy who got shot by the police. She has a young African-American son. So it's kind of all of that is like compounded into stressing her out, right? And then on top of that, she's taking her child to school. The principal, I assume, is coming to her, your child's hair is a problem. She's physically looking at other students who also have long hair. So it's just kind of just compounded stressors throughout the day and throughout her life that can build up and lead to other issues. She was complaining of pain. Her doctor's not paying her any attention, really. She barely looked up at her. So all of those factors kind of tie into different daily stressors that some women go through, and not just Black women, all women. But if you also add in the piece to where you feel like your voice is not being heard and you're getting ignored, especially by your provider, then that makes her, in the video, she's like, well, I went and nothing happened. And so I feel like the combination of all those things kind of may make some women hesitant to seek help because they feel like they're not going to get it, or they're just dealing with stressors that everybody else, is dealing with, so they don't see it as a big hindrance to their health care.
That's excellent. And like she said, keep in mind, this was one day. Mm-hmm. One day. All of these events happened in one day. So imagine day after day after day, those things happening, right? And this is someone who was very highly functioning. I hope you all picked up on the fact that their house was fabulous. I want to live there. Driving a nice car. They had nice things. And that's an important part of the narrative that I don't want you all to miss, okay? This has nothing to do with poverty. Poverty is a stressor, don't get me wrong, but they made a point in this movie for that to not be it. That's not the issue. This was a family unit, a husband, a wife, so all the traditional things that we think were not going on, and yet we still had this outcome. So you need to broaden your idea of what is a stressor, and of course poverty is a stressor, and broken home. Those are traditional stressors, but that's not always the case and always the root. So I really want to point that out. The other thing that I meant to point out on what Dr. Kitchen said was the support person. That's very important. You saw how the husband said, wait, you got to tell me these things. You went to the doctor, you didn't tell me these things. So let the support person be that. Be that. Maybe there are some times that the spouse is laying on the couch because the woman's been like, not allowed them in, during the pregnancy. So they feel like, well, I'm here, but I don't know. So there is truly an important role for that support person to play, and they have to be allowed and encouraged, to play that role. And we as healthcare providers can help give them that in. we can help the mom say, well, what's your husband have to say about it? What's your spouse, your friend, whomever it is? Invite them in so that they feel like it's okay for them to speak up and advocate. And perhaps, the husband, had he been there, perhaps he could have advocated and said, hey, now wait a minute, maybe not. But so I just wanted to point that out as well. Dr. Smith, let's go back to you. What are we doing? What are we doing in healthcare to address bias?
I would say we're running a two-lane highway in how we're addressing bias. So I think certainly when we look not only at nursing education, when you look at medical education, meaning the physician's education, when you're looking at how public health practitioners are trained, either through their master's in public health program or a doctorate in public health, we're certainly now talking about equity. We're talking about disparities. We're talking about biases, whether conscious or unconscious, and trying to teach that. At the same time, I think we also have to look at those other social determinants of health, those political determinants of health, those things that have nothing to do with you in the care of a patient where you're in the room or you're touching them, but affects how you take care of that patient. So when you take choice away from the patient, when you take choice away from the nurses, when you take choice away from those physicians, then I think in those cases, those biases begin to manifest themselves. And again, I go back to my first response. It is where you begin to advocate. It's where you begin to educate your clients, your coworkers, your teams on ways that you can best serve the patient. I would dare say to each of you, if I asked each one of you, why are you here? You're here to serve. You chose to go into a profession where you're going to serve. But if I asked you the question, who are you not going to serve, you probably wouldn't have an answer. And in the documentary we just saw, we saw someone that wasn't served. I doubt that doctor woke up that morning and said, I'm not going to serve this patient. But it happens when we don't put our unconscious and conscious biases in check.
Very good. Let's circle back to Dr. Sylvester. Are we doing a good job? I mean, how well are we preparing the next generation of providers to address the maternal and child health needs of Black families?
I think that when I look around and, even in this classroom, there isn't a lot of diversity, right? And I think that a part of the problem with grooming the next generation of providers is that there isn't diversity in the classroom where they can learn and interact with people who don't look like them. And so then when it comes to bringing up a topic to someone who doesn't look like them, they might be shy about doing it because they haven't had the practice doing it. So I think that things like this are extremely encouraging where the students are here, they're able to watch, but the question is, how do we let the students practice when they're not here? They have to be able to practice in the clinic, but the better thing to do, I think, is teaching them how they can engage with people in the community who don't look like them so that when they have to serve them, then it's not a scary thing to do. So I think that the efforts are good. I just don't know how effective it is going forward because we just don't have enough of us. But then, then you have people who are serving people who don't look like them, and they just haven't had the practice. So I feel like some schools are doing a great job at it, trying their best, but the best practice is going to be in the clinic, and sometimes students can't even, I know, give a dissenting opinion. When you were talking about the group think, I've had students who say, I was there, I wanted to say something, but I just didn't feel like I could. And I think that one way to help the next generation is to allow them to be heard so that if they have a dissenting opinion, that they're not looked down about it or for it, and that they're listened to, because sometimes they can see things that we as clinicians are in such a rush, that we can't see.
That's a very good point. I loved having students and residents with me. They always asked good questions. They asked hard questions. I had a student one time, I was in the OR, and the tip of my needle had broken off. And I didn't notice it, just the very tip of the needle. And it was the student that said, Dr. Walker, the tip of the needle is in the patient. And I was like, what? And it was right there. So I really value what you're saying about, making sure that our learners get an opportunity in the clinical setting, because there's value to having a learner on the team. And it's not, you shouldn't always feel like, well, I'm just here to learn. You are also a part of the team as well. And so I think we as educators have to make sure that we, continue to do that. So how do we increase diversity? How do we do that? How do we get more diversity? Any of the panelists?
Well, I would say most of our courses here at Middle Georgia, we do kind of thread in cultural competency in each class, whether that's like a case study through simulation. I know for the maternal health teachers in both ASN and BSN, we do cultural reports where they have to research different cultures and determine like what are their needs during pregnancy, their beliefs, their diet, things of that nature. So that is, one way we can bring in diversity without actually having it in the classroom, so to speak, but just exposing them to that. And then as well as like their clinical hours, when they're in the hospital, they get to take care of different types of patients. One of the things you said is about like being able to speak up. I do know as students, a lot of times, some of you, not all, some of you are very outspoken, but some of you are afraid to voice your opinions or speak up because you feel like, oh, well, I'm just a nursing student. I'm not really a part of the healthcare team, but it starts here. It starts now. Like if you notice something is going wrong or you feel like something is happening or you notice some bias, it's okay to speak up because you are the future healthcare provider. So get that practice in now. Don't be afraid. There will be a point in your career, no doubt, that you will experience some type of bias. And if we could get you guys to start speaking up, that is how we can begin to start addressing this problem and creating change.
I would certainly agree with everything that's been said. And I'd also like to add one step even, I think, before you get to school here. How many of you have younger brothers or sisters? How many of you have nieces, nephews, cousins? They watch you. They, in many cases, want to emulate what you do. So when you bring those instruments home and they want to touch them, let them touch them. Let them be part of that process. You didn't become a nurse when you finished or start your journey to become a nurse or whatever the healthcare profession is when you finished high school. Somewhere along the way you said, this is what I want to do, and someone encouraged that. Or if they didn't encourage it, at least they did not tell you no. So if we have former Girl Scouts in the room, go back and work with those Girl Scout troops and let them know, hey, you can do this too. Show them those instruments. Teach them what you're doing. And for public health with Scouts, there's a public health merit badge. It used to be one of the least earned merit badges up until what? COVID. Now it's in the top third. Folks want to know, well, who are these public health people that are supposed to be saving the world during COVID? So you can engage that younger population. If someone asks you, hey, would you mind being a judge at an elementary school science fair, be the first one there. Encourage those young folks to look at science. Because many times we look at science and math, oh man, that's the hard stuff. Well, I'm gonna let her do it, but I'm not gonna do that. Encourage them while they're small, and you don't know what they're going to be. So there's a quote that I use sometimes, and sometimes when folks are negative and you think that somebody's trying to bury you, they didn't know you were a seed. And what happens when you put a seed in the ground? It grows and it grows. So be that growth for someone else.
Absolutely. Okay, I was just about to say, we're coming up on time, but I definitely want to give any of you out there a chance to have a question or comment. And also, if we have anyone that's online, if we can check to see if somebody online has questions, type it in the chat, or I'm not sure how we've set that up. No, nothing. Never mind, don't do that. But Dr. David Smith.
Thank you all for sharing your experiences and your interpretations of the powerful film that we saw today. I just have 3 comments really that I wanted to make as we were discussing increasing diversity and helping people to recognize or see their blind spots. Because I think if you ask anyone, are you prejudiced? Most people would probably, no, not, one of those words. I'm like, yes, we kind of all are. We all have a ism of some sort. And I think it's important, one, to name it for yourself and then check yourself with it. Particularly when you go in the exam room, because the exam room is not big enough for your issues and the patient's issues. Mm-hmm. So you're going to have to figure out how to check your issues on the other side of the door. And whatever waits you on the other side of the door, you greet respectfully. And a way to be able to do that is if all of your friends look like you and think like you, your friend circle is way too small. Amen. And so I would encourage you to reach out and make friends, not acquaintance, friends with people who don't look like you, and you'll probably be surprised how much you really may have in common, even though you don't look alike. Mm-hmm. So challenge yourself with that. And then the third thing that I would say is when you're reaching out to help people, I really like the idea that Dr. Smith gave of going out and being a role model to others. It is important to recognize you're going out to be the role model and not the savior, because that's another way to really kind of disappoint or turn people off. I'm here to help you be better. So I'm here to share an experience with you. To share. So words matter, and after you've talked to a person, you might ask them, so what did you hear me say? How did you interpret it? Because right now I really think I'm just waxing on philosophically, and you might think, when is that woman going to shut up? And so it's important to understand what people heard and how they interpreted what you said, because we can be offensive without meaning to offend. And I think it's important after you finish a conversation to make sure I didn't offend you with what I said, because now it's a learning experience for me, and it's humbling, and it's also reassuring, I think, to the person that you're talking to, like, wow, they really do care, and they're not just here to check off a box. And my final thing was with your comment, the no empathy with the death. And I think it's, so it made me think about the hand up with the kid, because we really don't know what that physician experienced. And it is tough, the system that you're going into, because you will be charged with taking care of people that are dying, and then you have to go into the next room. Mm-hmm. And you can't carry that grief from that first room into that next room. But you are going to have to learn how to deal with it. And so that was my 2 cents.
Thank you. Did y'all take notes? That's some powerful words. We have another comment. Excellent, please.
My comment's not necessarily strictly about the video or women's health, but more so the doctor came in, never even looked at or put hands on the patient, was always right there at the computer. Mm-hmm. And as people, you have to be your biggest advocate, whether you're a patient or in the workspace or whatever else. Some people have zero problem speaking up and being heard, but some people are wallflowers as well. And then what do you suggest for young nurses that do have a question or is questioning something that's going on, and you have some providers that are either short for time or are dismissive of baby nurses, junior nurses, or anyone, because they might have that narcissistic tendency where they think that they're right and it's just round ligament pain or whatever the case is. What do you suggest for speaking up for not only yourself but your patient?
So the good thing about healthcare is that it's a team. And so you're not going to, everyone is not going to be dismissive or, you know, that arrogant jerk that just walked out of the room and told you to go follow someone else. One, you, as a student, you can always find your mentor or your
Preceptor.
Preceptor, that's it. Your preceptor, and discuss your concerns. But there are always other nurses and healthcare providers around that you can also express your concern. Don't just, if at first you don't succeed, try again. Don't just stop with that one. If it's a real situation, if you really want an answer or you really are trying to advocate to your patient, don't just stop with one person. That's the good thing about having a team.
I was going to say that's the same for people who are patients. I just had someone reach out who hemorrhaged, and she tried to tell a couple of different people who walked into the room, something is wrong, I don't feel right, I'm dizzy. And after about the seventh person, she went and told someone, and they caught the hemorrhage. And so we just have to not be afraid. I think that as women, sometimes when you said, you know, some people are like wallflowers, as women, when we have babies in our bellies, we don't want to ruffle feathers because we know that we feel like the person taking care of us, you know, we could make them upset, and we don't want to make them upset. But as women, I'm telling you, we have to express our concerns and continue to do that, because just like as students, you know that there is a team. As women, we have to know that there are other people that we can go to if our concerns are not being met.
I would add to that, and the key word is team. So, and it may not just be the team of everybody wearing a white coat. It may not just be the team of everyone that has on the same color scrub. But the other part of that, and it may be, you may find this most difficult, particularly when you leave this place and begin your career, but you're going to walk away with a great skill set. Don't let your skill set keep you in a place that your character won't allow you to stay. That makes sense? You've got a great skill set. There is no shortage of people to take care of in this world. But if your character won't allow you to stay there because of the things that you're seeing, speak up, advocate for the people that are there. But if your character won't allow you to stay there, I promise you there are other places that you can go. As a shameless plug, the health department is at 1600 Forsyth Street. I had to get that in. I got too many nurses in this room. But don't let your skill set keep you in a place that your character won't let you stay. You're going to be miserable, and you can't be that advocate for your patients.
Absolutely. That is so true.
That is excellent. All right.
Good stuff, Dr. Smith.
All right, we're going to take these last two comments, and then I think we're probably at time, at least for the online part. I think hopefully our panelists can hang around for a few minutes, and so please, if you were not one that wants to speak up in front of everyone, we'll hang around for a few minutes and be glad to answer some questions afterward. Go ahead.
As a healthcare provider, how do you comfort someone who just lost a baby or miscarriage?
So that can be quite difficult because each patient is very difficult, and you have to respond to their social cues. You know, as a patient, I was not someone that wanted someone to come up and rub on me. Please don't touch me. But then I have some patients that want to be touched and hugged and handheld. So responding to their social cues, it's particularly hard when they don't have a support person with them. If they don't have family support, and a lot of people don't have loving families or supportive families, or just even anyone to call a friend. And sometimes you and the healthcare team have to be that friend to that patient. It's hard as a healthcare professional because sometimes you carry that baggage with you. And you will sometimes take it home, and it can complicate your life. And so one of the tricky things that you all are going to have to learn is, how can I take care of this person in this moment right now? but when I leave this place, I have to leave this. So that's really, really something that's a very, very delicate balance. But respond to your patient's social cues.
Yeah, and I will just piggyback on that. What she said is exactly right. And asking the patient is never the wrong thing. How can I help you in this moment? I have prayed with patients. I have cried with patients. I have talked to them and explained. Some people want to know why. They want to know what happened. So it's never wrong to just ask them, how can I help you in this moment? They might say there's nothing you can do. They might, if it's something that you can do and they say that of you, it's meaningful for them to know that, my nurse, my doctor sat with me and held my hand, or whatever that request is. And if you can't do exactly, what they ask, then get as close as you can. I've left the room and I've come back, when I've said, I will come back to you, and they've appreciated that too. So depending on what's under your control and what you have the ability to do, but asking them is never the wrong thing.
And also making yourself available as a provider, because if you leave the room after you've comforted them, say, if you have any questions or you just want to talk, don't hesitate to call us. It makes patients feel a whole lot better, like someone's on their side. And you need to honor that, do that for that patient.
Okay, over.
I'll just comment too to say, and the thing not to do is assume what they want. And then label them as hysterical women.
Right.
And angry black women. So to be careful to not then bring your biases into what you think grief should look like. That's not your purview to do.
Go ahead.
Okay, I had a question. I know earlier we were talking about different type of biases and things like stereotype. When it comes to racial bias for like pain assessments for African American mothers, do you still think that exists today? Like, do you still think that they think that African Americans are being dramatic or being extra in a sense?
I certainly think it can.
Yeah.
I think it can. Because to the point that she just made, we all have we each individually have our own pain thresholds, right? And so it's easy to put that on someone else. Well, I mean, good Lord, it's not that bad. She's rolling all over the bed. She's doing all this, that, or the other, because we wouldn't do that. So again, it really just goes back to, don't put your pain threshold on someone else. You have to listen to what the patient is saying and not just label them as hysterical or doesn't look that bad to me. It looks, that's how we get into trouble, is putting our own experiences or putting, what it looks like, it doesn't look that bad to us. That will get us in trouble every single time. So I think it can exist, but we have to be the ones to make sure that it doesn't continue. And again, it also goes back to what Dr. Smith said. Nobody wakes up and says, today I'm not going to treat my patient's pain. It usually is not that. It is someone thinking, well, it can't be that bad. I just gave you some medicine. You don't get another dose. The medicine you have is only Q4 hours, so it's not time for you to have any more. Those are signals. If you just gave someone a narcotic and they're still rolling all over the bed, that's not normal. Something is wrong, right? So you have to really, really listen to that patient and understand what they're trying to tell you and what their body is telling them. And not everyone's able to communicate that, in the way that you might like, or you might, want them to. They have to communicate in the way that they can. And let me tell you, when you have a baby, you lose your mind. I promise you. If you've not had one before, you are a different person.
Yes.
So it's something that is difficult to comprehend yourself. I don't know if anybody else had a comment.
And as future healthcare providers, when you're doing pain assessments, don't think that everyone is drug seeking. That's one of the biases that we as healthcare professionals tend to, that's one of the first things we jump to. I think this person's drug seeking. Well, this patient may have a real problem that you just can't see. So really, really investigate. And as Dr. Walker said, if you just gave them a narcotic and they're still rolling around, something's wrong. Investigate, figure out what's going on.
All right. So thank you so much. Thank you to our panelists that gave us so much information and answered these questions wonderfully. Let's give them a hand. And thank you so much for your time, for your attention, for your engagement tonight. Again, your call to action is you take this information, you take your thoughts and your feelings, and you don't just leave them here in this room. You take them and carry them with you and really put them into use from now throughout the rest of your career. We've given you the beginning, but you add on to this and you really make it part of who you are as a healthcare provider. So with that, again, I say thank you and good night.